Hello guys, welcome to our YouTube channel. Today we want to talk about delirium and symptoms of it, a situation that some people may experience it in some times of their life, and some people may experience it in recovery room after operation. So if you are interested to know more about it, be with us until the end of the video. Delirium is a serious change in mental abilities. It results in confused thinking and a lack of awareness of someone's surroundings. The disorder usually comes on fast within hours or a few days. Delirium can often be traced to one or more factors. Factors may include a severe or long illness or an imbalance in the body, such as low sodium. The disorder also may be caused by certain medicines, infections, surgery, or alcohol or drug use or withdrawal. Symptoms of delirium usually begin over a few hours or a few days. They typically occur with a medical problem. Symptoms often come and go during the day. There may be periods of no symptoms. Symptoms tend to be worse at night when it's dark and things look less familiar. They also tend to be worse in settings that aren't familiar, such as in a hospital. Primary symptoms include reduced awareness of surroundings. This may result in trouble focusing on a topic or changing topics, getting stuck on an idea rather than responding to questions, being easily distracted, being withdrawn with little or no activity or little response to surroundings. Poor thinking skills. This may appear as poor memory, such as forgetting recent events, not knowing where they are or who they are, trouble with speech or recalling words, rambling or nonsense speech, trouble understanding speech, trouble reading or writing, behavior and emotional changes that they may include anxiety, fear or distrust of others, depression, a short temper or anger, a sense of feeling elated, lack of interest and emotion, quick changes in mood, personality changes, seeing things that others don't see, being restless, anxious or combative, calling out, moaning or making other sounds, being quiet and withdrawn, especially in older adults, slowed movement or being sluggish, changes in sleep habits, a switched night-day sleep-wake cycle. Now let's know about types of delirium. Experts have identified three types. Hyperactive delirium. This may be the easiest type to recognize. People with this type may be restless and pace the room. They also may be anxious, have rapid mood swings, or see things that aren't there. People with this type often resist care. Hypoactive delirium. People with this type may be inactive or have reduced activity. They tend to be sluggish or drowsy. They might seem to be in a daze. They don't interact with family or others. Mixed delirium. Symptoms involve both types of delirium. The person may quickly switch back and forth from being restless and sluggish. There are some factors that delirium is caused by them. They include drugs, epilepsy, electrolyte imbalance, liver failure, low oxygen, infection, retention, intracranial, uremia, and metabolism. Delirium and dementia may be hard to tell apart, and a person may have both. Someone with dementia has a gradual decline of memory and other thinking skills due to damage or loss of brain cells. The most common cause of dementia is Alzheimer's disease, which comes on slowly over months or years. Delirium often occurs in people with dementia. However, episodes of delirium don't always mean a person has dementia. Tests for dementia shouldn't be done during a delirium episode because the result could be misleading. Some differences between the symptoms of delirium and dementia include onset. The onset of delirium occurs within a short time, whether a day or two. Dementia usually begins with minor symptoms that get worse over time. Attention. The ability to stay focused or maintain focus is impaired with delirium. A person in the early stages of dementia remains generally alert. Someone with dementia often isn't sluggish or agitated. Delirium symptoms can come and go several times during the day. While people with dementia have better and worse times of day, their memory and thinking skills typically stay at a constant level. Thank you for being with us until the end of this video. I hope this video helps you to know about delirium and symptoms of it, and on the other hand, you learn about difference between it and dementia. If you are interested in medical work, don't forget to subscribe our channel and see our other videos.